Hello and welcome to today's webinar presented by the Lake Superior Quality Innovation Network on developing an action plan. I'm Kathleen Lavich, a Quality Improvement Coordinator for the Lake Superior Quality Innovation Network, or Lake Superior QIN. The Lake Superior QIN is comprised of three organizations: MPRO in Michigan, Metastar in Wisconsin, and Stratus Health in Minnesota. And we support the Centers for Medicare and Medicaid Services priorities for healthcare quality improvement in each organization's respective state. Our objectives today are to recognize the importance of developing a structured action plan, identify strong, intermediate, and weak actions, and to develop an action plan. Developing an action plan falls under Strategy 5 of the Change Package. Be a continuous learning organization. Action item 5C6 states, take advantage of existing performance improvement templates and tools that are easy to use and guide systems thinking to define the problem, test interventions, and measure the impact on the problem on the larger system. Tools are available to support your performance improvement projects, including tools to develop an action plan, including measurement. National Nursing Home Quality Care Collaborative nursing home participants are committed to appointing a multidisciplinary team within their facility, learn from the collaborative process, and conduct small-scale tests of change, and help successful changes become standard practices. If your actions inspire others to dream more, learn more, do more, and become more, you are a leader. The role of nursing home leadership is to guide, support, and encourage teams to develop new ideas and change systems for better outcomes, to be engaged and listen to their staff to help eliminate barriers that prevent them from doing their best work, and to work with their teams to assure that changes are sustained. Involvement of organizational leadership ensures that quality improvement initiatives are consistent with the mission, values, and goals of the facility, and also is reflective back to Change Package Strategy 1. Lead with purpose. Be the leader you want to follow and focus on systems for change. A key factor in closing the gap between best practice and common practice is the ability of healthcare providers and their organizations to spread innovations and new ideas that are based on evidence-based practice. The Change Package, for example, provides you with best practices from high-performing nursing homes. And the steps to accomplish this are the same as those used in any type of performance improvement project. 4 tips when making change: have a clear vision, be authentic, communicate, and follow through until the change is ingrained in the organization. Change is inevitable, and when you're conducting quality improvement, change is necessary to make improvement. Ways to reduce resistance to change is by setting goals and measuring outcomes, coaching people who are resistant to change. Ensure that those affected by the change have the right tools, training, and understanding to perform. Clearly communicate the reasons for the change. Be flexible and adapt as needed, and be proactive versus reactive. Again, Change Package Strategy 5, Be a Continuous Learning Organization, talks about focusing on the human side of change. Recognize how hard it is for people to change. Understand that staff need to know why a change is needed, which is the value of it, what specifically they need to do differently. Provide the support, resources, and tools they need, and check in with your staff frequently to see how the changes are going. Remove barriers that they face to make the changes. The action plan outlines the steps to carry out the team's proposed change. Explain the steps and show how the team will measure to ensure improvement occurs. Your team will identify actions to get the improvement or outcome that you want. Think about testing or piloting changes in one area of your facility before launching throughout, because some changes have unintended consequences. When designing action plans, clearly state what is to be done, by whom, and when. Action plans will be monitored, so it's important to have clearly defined measures. When developing your action plans, consider such questions as what safeguards are needed to prevent the root cause from happening again? What contributing factors might trigger this root cause to reoccur? How can we prevent this from happening? How can we change the way we do things to make sure that this root cause never happens? And if an event like this happened again, how can we stop the accident trajectory, or in other words, quickly catch and correct the problem before the resident is harmed? If a resident was harmed by the root cause, how can we minimize the effect of the failure on the resident? The team defines the actions, responsibilities, measures, and deadlines for implementing the change. The team needs to follow up on any ongoing action items that are identified and be ready to redefine any steps that aren't working as the team anticipated. Quality improvement depends upon staff who are trained and empowered to work as a team in real time to problem solve and use critical thinking skills to improve resident outcomes. Note that at this point in your performance improvement project, you may want to reevaluate the composition of your team to make sure you have included people who are part of the process being changed. It's a good idea throughout your project to make sure you have the right people on the team and to adjust membership as needed. The Department of Veterans Affairs National Center for Patient Safety developed a hierarchy of action and classifies corrective actions as weaker, intermediate, or stronger. Action strengths are based on the principles of human factors, where the most effective actions accommodate for human behavior. Weaker actions depend on staff to remember their training or what is written in the policy. Intermediate actions are somewhat dependent on staff remembering to do the right thing, but they also provide tools to help staff to remember or to promote clear communication. Stronger actions do not depend on staff to remember to do the right thing. Weaker actions support or clarify the process, but they rely solely on the human. These actions do not necessarily prevent the event or cause from occurring. Questions to ask in evaluating if the action is weaker would include, is this action focused on informing the person? Is this action establishing rules that do not already exist? Does this action prompt, warn, or alert a person, like capture their attention? Does this action examine if the process could be improved or made better? Is the outcome of the action left up to personal interpretation? An example of a weaker action statement would be, all computer users must maintain a strong, unique password for their system accounts. Intermediate actions modify existing processes, and they reduce the reliance on humans to get it right, but they do not fully control for human error. Questions to ask in evaluating if the action is intermediate in preventing the event or cause. Does the action help the person to remember the process? Does it improve upon the information needed to do the process? Does it serve as a guide tool used during the process? Does this action reduce variation of the outcome? Will most people do it successfully? And does this action account for human limitations of time and workload and tasks? An example of an intermediate action statement would be like a checklist. A checklist located next to the computer shows the steps and requirements necessary to log into the system, including password requirements. Stronger actions change or redesign the process. Corrective actions that change the system and do not allow the errors to occur are the strongest. It is helpful to involve supervisory and management staff in the action planning discussions. Designing intermediate and strong actions often requires an understanding of various resident care systems and the facility's resource allocations. Staff members on the team may not possess this knowledge. Because the feasibility and costs associated with corrective actions must also be considered, it's helpful to include the management in the corrective action discussions if they're not already members on the team. If a particular action cannot be accomplished due to current constraints, for example, a lack of resources, the team should look for other ways of changing the process to prevent a similar event from occurring in the future. Doing nothing should not be an option. Stronger actions are the best at removing the dependence on the human to get it right. They are physical and permanent rather than procedural and temporary. Questions to ask in evaluating if the action is stronger in preventing the event or cause. Does the action force the person to get it right? Does it eliminate the chance to choose the wrong option? Is it designed for the environment or system to operate without additional issues or concerns for the person taking the action? Can this be replicated successfully under any circumstances or by a different person? Does it require minimal supervision or measurement of compliance? Does it involve standardized forcing functions to remove human error and variation through technology and/or design? An example of a stronger action statement, for example, a forcing function, would be all passwords must be at least 8 characters long and contain a combination of upper and lowercase letters, numbers, and symbols. The login system will not accept passwords without these features. Examples of stronger actions would be changing the physical surroundings or adding engineering controls into the system, forcing functions or constraints, the design of the gas lines so that only oxygen can be connected to the oxygen lines, and electronic medical records cannot continue charting unless all fields are filled in. Additional examples of stronger actions include simplifying the process and removing unnecessary steps like unit dose, testing the usability of devices before purchasing them, and tangible involvement in action by leadership in support of resident safety. For example, leaders are seen and heard supporting the change. Suppose staff members cannot locate the equipment to use when lifting larger residents because the specialty equipment is not kept in the same location. The strongest action to prevent another accident would be to keep all equipment designed for special needs residents in just one storage area. So in other words, you're going to change the physical surroundings. Staff members will no longer need to differentiate regular equipment from specialized equipment. If this action is not feasible, consider placing a sign on the lift equipment, "Do not use for residents over 250 pounds." This is an example of a warning or a label, sometimes called a visual cue. It is a weak action because staff members might overlook the warning. But if no other stronger action is available, a weak action is better than none at all. In developing an action plan, aim for actions with a stronger or intermediate rating. Actions that change the system and do not allow errors to occur are the strongest. The goal is to implement the strongest action to change the system and eliminate the root cause. Common solutions such as providing more training or education or asking clinicians to be more careful don't change the process or the system, because those solutions are based on 2 assumptions. 1, that the lack of knowledge contributed to the event, and 2, if a person is educated or trained, the mistake won't happen again. Choosing actions that are tightly linked to the root causes and that lead to a system or process change are considered to have the highest likelihood of being effective. Actions that simply support the current process are considered weaker and should not be selected as the sole intervention. The goal is to make changes that will result in lasting improvement. To be effective, interventions or corrective actions should target the elimination of root causes, offer long-term solutions to the problem, and have a greater positive than negative impact on other processes. In addition, the outcomes of the actions or interventions must be achievable, objective, and measurable. Action plans will generally require creating a new process or making a change to a current process. The key is to choose actions that address the outcomes the team is trying to accomplish. Some action plans will be short-term interventions which can be accomplished quickly and will be short-term solutions, usually to fix a contributing factor. For example, purchasing an additional Hoyer lift rated for use for residents weighing over 250 pounds. But short-term solutions rarely fix root causes. Some action plans require more long-term implementation steps. For example, recommending that a formal evaluation of future specialized equipment needs for residents be regularly incorporated into the facility's strategic planning and budgeting processes. We're going to look at a couple different templates that you can use to develop your action plan. In this template, you can use this worksheet to identify your action plan and enter the root cause at the top of the chart. In column 1, designate the goal. In the next column, enter the specific actions that you're going to take to reach your goal. In the third column, enter the individual or the group responsible for completing the action. In the next column, enter the time frame for completion. And in the last column, enter a measure that will be used to show that the actions led to an improvement. Here is an example of this particular template completed. If you notice, they put their root cause at the top, the lack of consistent communication regarding therapy appointment times for residents. And they've completed it with a goal, which includes a measure. Their target is 10% or less each month. They've indicated 2 separate actions and corresponding people who will be responsible for those actions. In that fourth column, you would enter an actual date, and you see they have their measure indicated in there in the last column, the percentage of missed therapy appointments per month in that transitional care neighborhood. This template is from the CMS QAPI website and can also be used for your action plans. Here's one more example of an action plan template you can use, and it has a little more detail in it and includes the root causes. This slide shows an example of how to complete the template. Along with implementing action plans, develop ways to gather data that will be used to measure the success. Successful quality improvement processes create feedback loops using data to inform the practice and measure results. Fact-based decisions are likely to be the correct decisions. All of the following criteria should be met to conclude that an action plan as part of your performance improvement project has been successful. Measures of success are monitored over time. The goal was attained. Process changes were made and sustained, and no recurrent events. And you are confident that the change is permanent. What you measure should provide answers to 3 questions. Did the recommended action actually get done? Did the warning signs get put on the Hoyer lifts? Did a formal equipment evaluation step get added to the annual budgeting process? Number 2, are people implementing the recommended changes? How often is the wrong type of Hoyer lift used for residents weighing over a predetermined weight? Is staff provided an opportunity to participate in an equipment needs assessment during the budgeting process? And number 3, have the changes made a difference? That concludes our webinar on developing an action plan. As part of this learning session, we're asking you to complete an activity together with your team. Use one of the action plan templates that were presented today or one of your own choosing as part of your current or next performance improvement project. For further information about the Nursing Home Quality Care Collaborative, please contact your state lead in the Lake Superior Quality Innovation Network. You have now completed webinar 404 for learning session number 2. We will be emailing you an evaluation. To receive your nursing CEUs or a certificate of participation, please complete the evaluation. Thank you for watching, and thank you for all you do to improve the quality of care and quality of life for our nursing home residents.